We designed a trial with a primary endpoint of overall response rate at 24 weeks. Patients with treatment-naive metastatic HER2-positive breast cancer were randomized to receive either Herceptin or the proposed Trastuzumab biosimilar in combination with a taxane of choice. The institutions had to choose their taxane, and about 3/4 chose docetaxel and about 1/4 paclitaxel. After the 24 weeks, in accordance with our clinical practice all over the world, you can stop the chemotherapy and continue the antibody alone as long as you have responding or stable disease. So we actually reported at ASCO just the 24-week data, and what we saw in a group of patients, about 450 patients with metastatic HER2-positive disease in the first-line setting, was that the response rates were close to equivalent, and certainly the hazard ratio fell within an equivalency ratio. The FDA and the EMEA, the regulatory agency in Europe, had different requirements or requests for the way they wanted to see data. The FDA wanted to look at the overall response rate ratio, and the EMEA wanted to look at the difference. And then they set a narrow range that those differences had to fit into in order to be clinically equivalent. And this trial fell well within all of those guidelines with the overall response rate, the response ratio, and the response difference.